So you mentioned the word biomarker. I think it's a very important topic and a very important point. And so, Dr. Das, you'd mentioned kind of immunotherapy, but Dr. Young has just also referenced a targeted therapy, so EGFR targeted therapy. And so, if a patient qualifies, kind of has early stage lung cancer, perhaps they qualify for immunotherapy, chemotherapy, EGFR targeted therapy. How do we think about prioritizing those types of therapies for a given individual?
Yeah, it's a great question. I think, as I showed you, these perioperative trials, patients who had the driver EGFR ALK were excluded. So for these, we really do think about these patients a little bit differently. These are patients with EGFR or ALK are really felt to derive less benefit from immunotherapy. In fact, at our tumor board earlier this week, we had two stage 3A patients, one who had an EGFR mutation and one who did not. And when we were thinking about the treatment approaches, we ended up deciding on a perioperative treatment approach for both of those patients. But for the EGFR patient, we did not think about adding immunotherapy. Again, these patients were excluded from the perioperative immunotherapy trial. So this was a patient that we recommended neoadjuvant chemotherapy for, no immunotherapy. And then afterwards, after surgery, the recommendation was for that patient to get adjuvant osimertinib as per the DORA trial. So I do think we are in this era of trying to individualize treatment based upon driver mutation status, based upon PD-L1 expression. Again, as I showed you, the patients who have some degree of PD-L1 expression seem to have greater benefit with the immunotherapy. Does it mean that a patient who has no PD-L1 expression should not be offered immunotherapy? Not necessarily. And I think these are the nuances that we're trying to figure out. And then what do we do for patients with other driver mutations outside of EGFR and ALK? And again, we don't have definitive answers for this. I think a lot of us, who treat these patients with other driver mutations in the setting of being never smokers or light former smokers, again, that benefit of immunotherapy is I think really called into question. And so these patients still may be offered just neoadjuvant or perioperative treatment without immunotherapy. But, I think that there's a lot of discussion about this, and I think we're still trying to sort these things out.
Yeah, very, very well said. And I guess one thing that comes up in what you were discussing is that we used to think about biomarker testing as something we did for advanced stage mostly, right? Something that wasn't particularly relevant for early stage. And now as we're getting these therapies that really are nuanced, to borrow the word that you use, right? It depends on what your tumor markers are. It's becoming increasingly important for us to test. And perhaps I would even kind of venture to say test broadly upfront instead of just looking at EGFR or ALK. And so that's something that for patients, that's something your doctors are thinking about too, right? And I know sometimes it can be unsettling when you have a new diagnosis of lung cancer and someone says, hey, you have to wait a little bit because we have to get all the information before we can formulate the plan.